The Glenn Biggs Institute for Alzheimer's and Neurodegenerative Diseases at UT Health San Antonio is the region's first comprehensive center dedicated to transforming the treatment of dementia through patient care, education, and innovative research and clinical trials.
My husband and I met when we were in high school. We were high school sweethearts. And after we graduated from high school, it wasn't long after that we got engaged and we got married. And we've been with each other ever since. My brother had Alzheimer's, and because my mother had Alzheimer's, and we had gone through a long journey with them, I knew what the symptoms were. And so when I started forgetting my children's birthdays, which more than anything else, that's what hurts. And that's the fact that I don't remember anymore. At the beginning, I was a little bit in denial, hoping that what I was thinking was happening was really not happening. So at the beginning, I didn't share it with anybody. And it was several months before I told him, we need to talk. I think that I've got Alzheimer's. Then that's when he told me that he had noticed that I was being repetitious and asking the same questions over and over again. And so that's when we decided to go see my primary care physician.
We said, I think that we would like to talk to a specialist that deals with Alzheimer's. He says that I've got the perfect one for you.
So when the Rodriguezes first came here to clinic, it was because they had noticed that Mrs. Rodriguez was having a little bit of trouble with her memory, which was a change for her. And she really wanted to get that checked out and see if there wasn't anything that she should do to make sure she stayed healthy. So when they first came, she brought her family with her. And she has a really wonderful, supportive family to help give additional history and to just make sure we got a good picture. And then after we went through all of the history, we did an exam. And then we talked about how we would work up her care. And once those were all done, we came back and went over everything together. And we discussed that she had some mild changes in her thinking and in her cognition, and that was likely related to Alzheimer's disease. After we had talked about different medication therapy, we talked about some other things that she could do to really help with her brain health and just her overall functioning. One of those things that we thought about was just doing a little bit of counseling, and that is primarily helpful with just recognizing the changes that are happening and kind of how to deal with it and adapt to it for the person experiencing the memory changes, but also all of their family.
They referred me to counseling services. And I was fortunate enough to be referred to Melissa. Just a life sent for me. Some days are harder than others for us, and some days, as I realize how the disease is progressing within me, I'll walk into her office and I'll say, Melissa, and I let it all out. And I tell her I'm sorry I have to dump on you, but she says, that's what I'm here for.
We are dedicated to finding tomorrow's treatments today through innovative research and clinical trials. We work closely with the Sam Ann Barshop Institute for Longevity and Aging Studies at UT Health San Antonio to better understand the risks and predictors for Alzheimer's disease, mild cognitive impairment, and related conditions.
Our vision is to provide compassionate, complete, and comprehensive care to people from the first concern about memory problems through the stage of accurate diagnosis and targeted treatments until they may need palliative care and comfort care. And to do this, we have a team that includes neurologists, psychiatrists, geriatricians, different types of therapists, occupational, speech, dietitian, social work, as well as caring for the caregiver.
The Biggs Institute, we understand it takes a team of family members, caregivers, and healthcare professionals to deliver the best care. We provide educational and supportive resources to fulfill this promise.
The hope that in my lifetime, we will be able to prevent and treat Alzheimer's, that in at least a third of people will be able to win back their precious memories and stop the disease in the others. I believe it can be done, and that's the hope that keeps me going.